Good afternoon, ladies and gentlemen. My name is Daniel Trattler. I'm the moderator for the World Health Summit Startup Track. For those of you here for the first time, the Startup Track is a way for the World Health Summit to support and help spread the word, to use their power to support innovative startups, healthcare startups from around the world. And this year we had candidates from 19 countries and 5 continents. Today we will be seeing the 10 finalists. We'll each have 3 minutes to present their case, and then followed up by 2 minutes of questions from our distinguished jury sitting in the front row here. Maybe our distinguished jury can stand up quickly. So I'll read their names really quick. Dr. Kai-Uwe Binzeil from Berlin Partner, Jutta Klauer from Pfizer, Professor Dr. Tobias Kurt from Charité, Dr. Shari Langemak, physician and digital healthcare expert, Dr. Markus Müschenich, Flying Health, Timo V. Schmidt-Lord von Bayer, Dr. Anna Babette-Stier, German Federal Ministry of Health, Dr. Alf Wachsman, Max Delbruck Center for Molecular Medicine. Then we have Uta Weilen, Deutschland, Land of Ideas, and Dr. Rolf Settel, Berlin Institute of Health. Great. So let's just get started then. I have to get my other note here. So this first contestant has a special meaning for me because my teenage daughter is visually impaired, and I know very much firsthand what it means to be visually impaired in a world made for sight. Please welcome Rumpam Sharma and Eyeluminati to the stage. I guess you have your own microphone. Here you go. I think it's all right.
3 years ago, while researching colorblindness, I had this profound moment what it would be like to live in complete darkness. Upon first-hand blindfold experience to build empathy, I came to a realization that for somebody who's living in poverty in India, the impact of blindness is extremely serious. Of all the 200 people who we interviewed before building this technology, most of them emphasized on the shortcomings of Braille, which is the current medium of literacy to them. The most essential capability that they lack is the capability to read. Over the last 200 years, they've been reading with Braille, which has considerable shortcomings, such as difficulty in reading, availability of Braille tutors, availability of books at a cheaper cost, and on and on. There exists 85% unemployability rate because more than 90% of the people worldwide do not know how to read Braille. In my native country, India, this stat goes to less than 1%. For the 99% of the people, there exists no medium of literacy. Our team wants to change this. For this, we have built ManoView, which is the world's first wearable visual assistant for people with visual impairment. Mano in Spanish means hand, and view in French means vision. With the ManoView multi-utility wearable glove, the user simply points his finger towards any kind of text, and the device reads out aloud what is written over there. ManoView is a very inexpensive technology that is meant to replace the 200-year-old Braille system and brings independence, empowerment, and employability to the visually impaired. We have tested our system with more than 800 users across 12 organizations in India, and we've received a great feedback. What we are working on right now is to reduce the cost of this technology to make it accessible in the least income settings. Our price starts from $28, and we are covering a wide range of spectrum from people who are least desperate to the people who are most desperate for this technology. ManoView is a cognitive learning device which can also assist people with dyslexia, people who want to learn new languages, people who are recovering from a brain trauma, or even people who are seeking a distraction-free reading experience. I can talk on and on more about this, but we can answer this during the Q&A. And so if you're somebody who's passionate about helping these communities, and come talk to us backstage, and I'm more than happy to talk. And thank you so much. Thank you.
So we have some questions from the jury. Nobody? Please go ahead. Go ahead.
Just a quick one. Just technically, maybe I missed it. How does it work?
I didn't get your question.
How does it work technically?
Sure. So there's a camera on the index finger which is taking pictures. So it takes a picture of the scene. If there is a text, it takes a picture of the text, converts that to OCR, and does a text-to-speech translation. Apart from that, for the other scenes, we're using computer vision to enable scene description. So it's taking a picture of the scene and doing a computer vision for that, and it's translating that to any kind of scene description that is required.
Maybe I can ask you another question. I mean, if I'm visually impaired and I cannot see that there is a text, how do I recognize that I can use my device?
Right. So when we were 8 months into the prototyping and piloting and testing this with the people, we realized this problem after 8 months. So what we came up with is a mechanism where the person actually can get to know where to point. So this device has a haptic feedback on all the 4 index fingers. Haptic feedback means vibration on all the 4 index fingers. So this vibration feedback directs the person to the starting line of the book and directs him towards the text. So there is the camera which is taking pictures continuously, and it is automatically recognizing where the text is, and this haptic feedback takes the person towards that text.
Okay.
I'm more than happy to answer any questions in the booth, and thank you so much for the opportunity. Thank you, sir.
Thank you very much. Great. Okay, so I'm also really going to pay attention to the second contestant because my wife keeps telling me I'm hard of hearing. So please welcome Dr. Charles Bate and Lira App to the stage.
Thank you. I'm Dr. Charles Bate, and I'm founder at Lira App. So our vision is to provide quality hearing care for all people. And we are doing this by building sustainable digital solutions that bring hearing care closer to the last mile. At Wulira, we espouse innovation, people-friendly services that bring positive social impact for our communities. Now, Wulira comes from a local Uganda word, or Wulira, which means, can you hear? It is an easy-to-use, simple, but robust mobile phone application that is being used to screen for hearing loss. 500 million people around the world live with disabling hearing loss. And evidence tells us this hearing loss can be prevented if detected early. But we cannot detect it early, especially in low-income countries. Because, according to the World Health Organization, there is only one audiologist per every million people. And therefore, millions of people are out there with no access to this hearing screening service. This is the gap that we've identified, and we are addressing it by improving access to hearing healthcare for the last mile. Our app performs the hearing testing within 5 minutes. It gives the patient a diagnosis of their hearing level based on the World Health Organization's classification. It takes hearing testing outside the booth, and therefore it is cost effective. Now, compared to the gold standard, the pure tone audiometer, you require a soundproof room, you require a trained audiologist, you require an expensive pure tone audiometer machine to perform one hearing test. With our innovation, all you need is your mobile phone and minimal training for any one of you to perform the testing. Our team has the requisite skills to carry this innovation forward, and what we are looking for today are impact investors to help us scale this innovation, but especially each individual one of you. Invite us to your countries. Let us test this innovation in your healthcare systems. Let's improve access to hearing care for all. And I thank you.
We have some. Shari?
Thank you. You made it very clear that hearing loss is a very important problem worldwide. Maybe you can explain to us what the consequences would be if you recognize an early hearing loss and what treatments are available.
So, number one, people who develop hearing loss have extensive social and economic problems. They cannot retain jobs. They cannot maintain social relationships. When we detect hearing loss early, we can, one, give these people hearing aids that help them amplify sounds they're hearing to be able to detect and understand communications and to communicate with other people. That way, it makes them more productive. It makes their engagement with other people more productive, and it means their health-related quality of life is much better than when they progress to permanent deafness or permanent hearing loss.
Is this system good in the hands of each individual person, or should it be in a local care community where some experience actually and information for the next steps?
So what we've done in our first version, we've developed it for the healthcare managers. When we launched the Wulira app a month ago, we invited different healthcare providers that are audiologists to come and see how it works and give us feedback. A majority of the people that have downloaded the app currently are healthcare providers. They are professionals. However, the key question we have in improving access is how do we get individuals also to be able to perform a screening test on their own at their homes among their own relatives. And that's why we are automating the entire testing process so that when an individual who is non-trained downloads the app, all they need to do is hit the start button and the test will be running in an automated fashion. The data will be collected by a central database that will interpret and give a patient-relatable diagnosis, but then refer them to a specialized healthcare. Thank you very much.
I think that's all the time we have. Thank you. So for anyone who's had first-hand experience with melanoma, they know what a terrible disease that can be if not treated early. Please welcome our next contestant, Magnosco, is developing a new treatment, a new method of treatment. Please welcome Dr. Sebastian Alberg.
Hi everyone, my name is Sebastian and I'm working at Magnosco. We developed a device for the early skin cancer detection. And why is it important? You may know that skin cancer is the fastest growing cancer worldwide. And the malignant melanoma is the deadliest form. Only in Europe, we talk about 22,000 people yearly die on the behalf of this disease. But there's hope. If you're able to detect this disease in a quite early phase, the treatment is very good and the possibility to cure the disease is over 90%. Let me quickly show you how the process nowadays works, because there are some pain points in it. First of all, you need to identify the lesion as a malignant melanoma. This is performed by a dermatologist. But this depends on the experience and the quality of the dermatologist. So it's highly subjective. If there's a suspicious lesion, he will remove the lesion or will do a biopsy. So in the end, you have a little surgery, you can get a scar, you have complications. So it's quite uncomfortable for the patient. Then the tissue is sent to the histopathologist, to the laboratory, where it gets identified. That takes around about 2 weeks. 2 weeks of struggling for the patient. And in the end, only 3% of the lesions are really confirmed as a malignant melanoma. So here's what we developed. With the Magnosco Derma FC, we have a CE-certified medical device, which is based on physics. It uses a patent laser spectroscopy method and artificial intelligence. It is non-invasive, so very comfortable for the patient. It is an objective method which gives a recommendation to the physician within minutes. It's easy to use and it can be performed by the medical staff. In 2018, we had a soft launch installing 5 devices on the German market. And as we want to give access to this technology to everyone, we provide it in a licensing, in a pay-per-use model. The next goals are the German-speaking countries in Europe and the UK, and of course the highly prominent market, Australia and the US. We will not stop here. We still have some things to improve. So we're improving our Derma FC. We're also planning an app as a retention tool, bringing the patients to the dermatologist, and also a device for the laboratories for the histopathologist. So in the end, we want to become the one-stop shop for skin cancer screening and being part in every step of the customer journey. Right now, we're in an investment round, so if you want to work with us, please feel free to contact me. And as I have a few more seconds, let me bring awareness to this topic. Go and see your dentist. Use the opportunities you have on skin cancer screening in your country. Thank you.
Thank you very much. Questions? Somebody? Here's a question here. Can you give her a mic?
Oh, I have one. Sorry. Didn't look. One question. What is needed in terms of investment for a hospital or a dermatologist practice to buy your device?
Yeah. As I said, our main goal is not to sell the device. It's kind of rental. So the dermatologist or the clinic has to pay a little installation fee. And after that, he gives us a share for every examination he does.
Another question here? You give her a share. You give her a mic.
Do you see your device more with an additional support or rather, I'm thinking of a second opinion, or do you think it can replace the common way of diagnosis?
Yeah, we don't want to replace the dermatologist at all. We want to support him. So it's an additional diagnostic support for the dermatologist. So if there is a lesion he is not quite sure, he can use our system and get an additional information.
Okay, that's good. Thank you very much. Our next candidate is already on the stage, DX-Labtrack. They are addressing the complex challenge of blood transfusion safety around the world. Please welcome Dr. Hans Hein.
Thank you so much. So, why are we here as DX-Labtrack at the World Health Organization? because we think there should be a system change in how healthcare startups actually operate. We all know that there are a lot of expensive and exclusive healthcare solutions for the few that can pay for them and that can afford them. But we think that actually inclusive healthcare startups are needed. And these should be companies that have an excellent technology and use the technology not where the profit is the highest, but where the pain is the highest. So what are we doing? We work on smart, safe blood. We do real-time quality assurance of blood. So where is the pain the highest? In crisis and conflict situations, where hospitals are destroyed, where labs are destroyed. There you need in real time to know what kind of blood is arriving there. And what thing actually works in a crisis till the last moment? It's the smartphone. We all know that. So we have a technology that we can apply right on that situation. So we have a patented smart RFID label technology that we can use, that we normally use for human samples, but that we can also use for blood donations and other blood products. So we attach them on them, we identify each and every product, we can see their temperature, we store these products in our smart storage containers where we have an inbuilt technical level of different sensors. So each and every sensor detects possible quality deterioration of the product between where it starts at point 0 and at the end at the patient. So, and if we are now in the eye of the hurricane somewhere and you're a doctor of the WHO or of the Red Cross and you are in Idlib and that thing arrives, that package arrives, so with our technology, you just put that your cell phone, on the package. You switch on near-field communication and you communicate with each and every thing in that box. You know the quality, you know what's in the box, and you apply it right to the patients. No more time lost, nothing. So that's innovation that we need. And I need this. Sorry. So what do we do actually? We bridge pre-application information gaps. That's good for the patient in a crisis situation. It's needed to save lives. It's good for the healthcare professional because he is not burdened with manual troubleshooting anymore. And it's in the end good for global health. And this is what we're all here for. We want to be that quantum leap for the WHO blood and transfusion safety program where it's exactly stated, create an integrated blood supply network. And this is what we are doing. We have a proven track record of feasibility. We won the Munich Hackathon. We won as best e-health startup in Europe, the Wildcard Challenge. We are selected by Plug and Play from the Silicon Valley in the Digital Health Accelerator Batch 1. We are a diverse team of founders. We have a female co-founder coming from computer science. Malte is a practicing physician from the hospital. Timo comes from the lab. I come from regulatory affairs. And this is the last slide. And today, I want to stretch out the hand to really do inclusive startup. Thank you so much.
Thank you, Dr. Hein. That was very passionate. Questions?
Yes.
Anybody? Okay.
Yeah, sorry. What can you exactly say about the quality by putting the smartphone on the blood test?
Yeah, very good. Yeah. Very good. So if you have a blood donation, let's focus on that scenario, and you are in the eye of the storm in Idlib. So you as a doctor want to be sure, first of all, what kind of blood is in there, to what kind of patient can I apply it, and has been the blood in a good condition. So what about the temperature? From wherever the blood comes from, what about vibration, what about light, all these factors that possibly negatively influence the quality of blood. And with the current technology, you cannot detect that. So the doctor has to assume whatever arrives is in good quality. But quite often, as we know, it is not. And with our technology, the inbuilt sensors, we check all the data continuously in real time. We store it in there. And with the smart chip that is in there, we built something which we call a digital human sample blood fingerprint. So you just put the smartphone on, and it says you're in a normal traffic light sign. Green, just apply it. Yellow, quality deterioration, and red, don't apply it. Don't give it to the patient. It will do harm to the patient. And that works with near-field communication, so no Wi-Fi, no GSM connection. Every other means can be destroyed. You don't need a lab anymore. You don't need a hospital. It's just a smartphone and the box.
Thank you very much, Dr. Hein. So, I need that. So good. That's great. Neonatal and maternal diagnostics. I think that's something we can all get behind. Please welcome to the stage Aaron and SpotSense.
Good afternoon. I'm beaming as I walk up here because I heard the voice of my biggest champion right in the audience. There is a handheld bundle of joy that cooed and cawed and renewed in my mind why we are doing this. Our journey at SpotSense begins with a story of a young couple who just got the greatest news that their beautiful bundle of joy has been delivered. They're itching. They just want to take their bundle home and start their new life with her. But the doctor sees reduced movements, some breathing difficulty, maybe some sluggishness, so wants to do a few blood tests. Why? About 4,000 babies are born daily with proven clinical infections. 10% of the babies born at a facility are at risk of sepsis, and this increases to about 30% if it's at a community medical center or a community health setting. The only confirmatory test that's available for doctors, and I'm sure the doctors here will agree, is a blood culture, which has long turnaround times, has to have access to a pathology lab, and always has sampling difficulties. What do I mean by sampling difficulties? The way you extract sample from a neonate is something called a heel stick, right? A small glass capillary is stuck into the heel of the baby, and it sucks in a little bit of a blood sample. A few microliters, which you have to be very careful to handle and hope that it's a representative sample of what's happening in the blood. There is not even a consistent, uniform definition of sepsis. Believe me, we looked it up. To sum it up, it's the body's own reaction, immune system reaction, that is responding to an infection and actually affecting the body, which is supposed to protect. This is not a simple problem. It causes a 6-fold increase in the cost of childbirth. It increases the number of admission days to 10. So you want to take the baby home, you have to wait a few days now. And it has been proven to significantly increase the risk of mortality. 17 million babies are known to have sepsis in India alone. At the core of this problem is a lack of diagnostics which are sensitive, rapid turnaround, and accessible. If these three are there, it will change the paradigm of how sepsis is treated today, which is empirical diagnosis. Clinical diagnosis is the only tool available to react in that moment when the doctor suspects sepsis. Our solution to this is drooling. We use saliva as the sampling medium. We take samples from saliva, we do a non-invasive test, rapid, produce view, which is a LFA-based assay, and transmit the results. So this enables tracking as well as instant diagnostics. Thank you.
Thank you, Aaron. Questions? There must be a question about that. That was pretty interesting.
So due to the rush of the time, you skipped over that slide. So you do have an analytics device that then looks at the saliva and looks at the biomarkers and tells the doctor, yes, there is sepsis or not.
Yes, we sample about 4 biomarkers which are known in literature. It takes about a few ml of sample, actually less than that. It's in the form of a pacifier. There is an LFA test attached to it, and it gives a readout. We also have a colorimetric-based reader which standardizes and gives a number. Based on this, it calculates a score. We also take in other clinical symptoms, gestational age, etc., to make the score really sound.
How does this score compare to regular methods? Like, do you have any numbers on like how often it fails to detect the sepsis? How often maybe a sepsis is detected when this is not the case?
So there are a few things that physicians use. So for example, CRP indication is one, but there are a really quantitative test for CRP is very difficult to come by. So that is one of the biomarkers we use. But we have also augmented it with 3 other biomarkers. So we've done a study of about 120 babies at CMC Vellore. We are at about an 83% specificity and 80% sensitivity now. I might have mixed those numbers up, sorry, but around 80-85.
Okay, thank you very much, Arun.
Thank you.
So our next contestant is focused on something that we all hope we don't have to deal with, but if we do, we certainly want to get it treated. Pay It Forward has a wonderful concept of how to pay for gonorrhea and chlamydia testing. Please welcome Catherine Lee.
In Guangzhou, China, 1 out of every 10 gay men is infected with gonorrhea, and 1 out of 6 with chlamydia. Gonorrhea and chlamydia are insidious sexually transmitted diseases, which may be asymptomatic at first, but can then go on to cause severe complications. On top of this, men who have these infections suffer from shame and cultural stigma, which only delays treatment and increases disease transmission. 80% of gay men in China have never tested for these diseases. Our goal is to increase gonorrhea and chlamydia testing in the gay community and to build a culture of openness that encourages gay men to take ownership of their own health. Our organization is called SESH, Social Entrepreneurship to Spur Health, and we aim to empower communities to design and effect their own health services. Our previous projects have focused on crowdsourcing, where we solicit ideas, designs, and strategies from the community and synthesize them into healthcare services and campaigns. This time, we have designed a service based on the concept of Pay It Forward. Pay It Forward is where one person receives a gift, in this case an STD test, and then passes on a gift to the next person, thus generating a cascade of kindness. The concept of Pay It Forward has been widely used in the past. You may have even seen it at your local Starbucks. In our program, we begin with a limited funding pool that can cover the cost of a few tests. We tell each person that he can get a free gonorrhea and chlamydia test today, which is covered by the funding pool, as well as by donations from previous testers. Then at the end, we ask if he might also like to contribute to the next person's testing. Each person can choose to donate any amount they wish or not to donate at all. This way, each person benefits from the Pay It Forward donation of previous testers and can also choose to pay it forward to future testers. We piloted this program at 2 sites in Guangzhou. These were community-based sites for gay men. We found that, through existing services, only 6% of men got tested for gonorrhea and chlamydia. But when we offered the Pay It Forward service, 54% of men got tested. Not only this, 89% of them chose to contribute to future participants, and the money that was donated covered 80% of the direct cost of testing. We also encourage participants to write messages to future beneficiaries of their donation in order to encourage them to test and build a sense of community. These are just a few examples of the messages we've seen. If our program expands within Guangzhou, we could identify and treat almost 5,000 cases of gonorrhea and chlamydia in the next year. Our next step is to partner with a network of clinics for gay men across China and bring Pay It Forward to 3 more Chinese cities. A big thank you to our community supporters and partners, and I'll leave you with an anecdote from a Pay It Forward participant. Thank you for hearing us today.
Thanks, Catherine. So stay there. Maybe someone wants to ask you a question.
Why do you have a focus on gay men? Shouldn't it be as interesting for the entire group of men?
Yes, there are a couple of reasons why we started out this project with gay men. The first is that rates of STD are particularly high, as I mentioned in my first slide. They're a particularly at-risk population. Secondly, our organization SESH has worked with gay men in the past, so that's a population that we're familiar with and a good starting point for us. And third, in China right now, the gay community is becoming very active, and they themselves are beginning to initiate efforts to increase their sense of community and to identify and to encourage each other. And so we thought this would be a good population for this type of a service to work. But in the future, we do plan on expanding to other populations as well.
Do you think that this paid-forward approach will work outside of China in different cultures and communities as well?
I think that the great thing about Pay It Forward is that it can be applied to almost any healthcare service that requires a small fee in almost any context, and that it can be transmissible to different countries depending on what the local issues are in your country. You can apply it to any kind of service, whether it's for maternal health, whether it's for non-communicable diseases, and that as long as you have someone on the ground who understands the culture and how to kind of motivate people to participate in this program, then it could work anywhere.
I think we have time for one more. Okay.
From the figures you showed, there's only a small step to sustainability. How are you planning to bridge this last gap?
That's a great question. So I think, first of all, we have only piloted this program without kind of optimizing the specifics of the messaging at all. And I think that after we do that, we may be able to increase that. The second thing that we're planning to do is to negotiate costs. So currently, we're taking these tests directly from a hospital. But if we're able to negotiate with providers of these tests, we may be able to decrease the cost of testing overall. And then finally, I think that so far, we've only talked about the tests that we're providing, that as the service, and then gay men as the people who are accepting this service. But actually, we're creating a lot more things of value with this program. We're creating a community of gay men who are invested in their healthcare. And we're also identifying cases of gonorrhea and chlamydia, which never would have been identified before. So I think these would be of interest to academics, to government, to public health, and then also to private sponsors. And then I think that it may not be even necessary to have this program be entirely sustainable by the gay men's donations themselves.
Okay, thank you. Very interesting. So, hello. Sometimes great ideas are not about creating new treatments, but making existing treatments more accessible. So, welcome to the stage, Fan Yan, richtig? Fan Yan, from Casper Health.
Have you had back pain, an arm injury, problems with your knees? Nearly 1 in every 3 of us suffers from musculoskeletal conditions, which are the second largest contributor to disability. Yet 80% of the population who need rehabilitation treatment do not have access due to financial, geographic, or medical resource constraints. Meet Casper, the first AI-powered teletherapy platform that addresses musculoskeletal conditions. We empower healthcare providers to work faster, better, to provide affordable services to more people in need. So how do we do that? On Casper, healthcare professionals have access to the world-class rehabilitation know-how, which is consisted of both clinical exercises and patient education seminars. So they can easily pick a therapy plan, adjust it, and send it away to their patients no matter where they are. What's better is that our proprietary algorithm analyzes data on patients' diagnosis, progress, and activity, and automatically generates suggestions for individualized therapy plan. And we know patient compliance rate is always a big challenge. That's why on Casper, patients not only have access to their individualized therapy plan 24/7, but also progress report, instant feedback from the doctors and therapists, all on their smartphone. This is not a dream, it's reality. An independent research study by German Railway and German Pension Fund showed Casper has increased the patient compliance rate from 25% to 75%. In Germany, we've already reached 89% of insurance coverage. And in the last 6 months alone, we've empowered healthcare facilities of more than 114 and also treated nearly 24,000 patients. Internationally, we have 6 pilot projects running, including 2 in China, where I come from. I've witnessed the significant changes Casper has brought into those people's lives. But there's so much more we can do and so many more people we can help. That's why we really look forward to talking to you, healthcare providers, insurance companies, academics, researchers, NGOs, and let's work together, join forces, and make this world a healthier place. Thank you.
Thank you. Do we have some questions? Anybody? Okay, the girl.
How does the app come to the patient, and who finally pays?
It's a good question. So the first question is that how does it come to the patient? We work with healthcare providers. So what's really important is that we actually integrate Casper into their clinical process. And it means when patients are staying at the hospital, they already started to use Casper. And when they check out of the hospital, when they go back to the community and home, they already got used to it. And the second question is that who is paying for it? Right now, we are working with the biggest contributor in rehabilitation, which is a German pension fund, and they are covering the whole expenses. But in Germany, our insurance coverage has reached 89%, and we wanted to work with more healthcare providers and insurance companies all across the world. Hope it helps.
Yeah. What's the main motivation for healthcare providers to work with Casper?
That's a very good question. So we consider ourselves the smart assistant to healthcare providers. With us, they actually not only treat their patients better, because with Casper, they have access to the best rehabilitation knowledge, but also we help to increase their work efficiency. So it means that with the same number of healthcare therapists, they actually can treat more patients. And what's more importantly is that right now when patients get out of the hospital, usually they stop their exercising and they stop their rehabilitation treatment. But with us, hospitals can actually provide extra services for those patients who they are not in connection with anymore.
Okay, thank you very much. Gene therapy continues to be a hot, forward-thinking topic. Strand Therapeutics has a unique take on this as an application for cancer treatment. Please welcome Jacob Beecraft.
Four out of 10 people will develop cancer at some point in their lifetime. However, for the first point in human history, we stand on the precipice of actual real change in the way that we treat cancer. Cancer immunotherapy, rather teaching the immune system how it can recognize and kill cancer cells, is nothing short of a revolution in the way that we respond to cancer. Specifically, the leading drug here is a drug called anti-PD-1. This allows the immune system to have its brakes taken off and attack cancers in order to form an immune response and give a real, actual cure. However, in melanoma, its leading indication, only 40% of patients respond. When we look at something like breast cancer, less than 10% of those patients respond. The issue here is not only the non-response rate, but the new therapies that are coming online in order to address these non-responders are massively expensive and unable to be accessed by most populations across the world. At Strand Therapeutics, myself and my team work to find ways that we can make affordable gene therapies to address these issues in cancer. Specifically, gene therapy is focused on a way to engineer viruses to attack these cancers and further stimulate the immune system. However, viruses are massively expensive to manufacture and often very untargeted and unsafe for a number of populations. At Strand Therapeutics, we actually use synthetic biology to make a new type of synthetic particle that's actually able to infect cancer cells specifically and kill them and further stimulate the immune system, all for a price less than 1/1000th of a dose of a viral therapy. Specifically, Strand harnesses a field called messenger RNA therapeutics. If you think of DNA making RNA, making proteins, we operate right in the center of that. This actually gives us a massive amount of cost savings over over other sorts of approaches. We use another field called synthetic biology to actually make these approaches very safe, actually engineering cancer cell specificity into our vectors. Strand Therapeutics exists in a broader landscape. Synthetic biology companies have evolved to kind of address some of these pain points, and we exist in the only synthetic biology company that harnesses the power of messenger RNA therapeutics. Very, very briefly, I'll get here. We have dosed some of our mice with the leading agent, anti-PD-1. We see a 25-day response. Though when we combine it with our vector, we actually see a curative immunity in over 80% of the mice at 150 days. All in all, we look at the first total addressable market of 100,000 patients. But in the U.S. alone, in our later stage vaccines, we plan to address over 500,000 patients a year with our ability to get to different sorts of indications. Our team represents key opinion leaders and thought leaders from the Massachusetts Institute of Technology, where I founded this company with my PhD advisor, Ron Weiss, as well as our strategic advisory panel, which is experts across the field of gene and cell therapy. We're Strand Therapeutics, and we're here for a fair chance to live.
Perfect ending. The gentleman here has a question.
Is there already some venture capital backing for the company? What's your strategy, reward financing?
Yeah, we're actually in at the very end stages of a small for Cambridge, Massachusetts biotech company seed round, so of a few $1 million. We have both institutional investors as well as strategically placed like ultra high net worth individuals from biotech as angel investors. But if you know any venture capitalists, I mean, happy to talk to them as well.
Anybody else? Another question? Okay, one more.
Yeah, you talked about mice and results in mice. How far along are you on human testing?
I'm sorry?
How far along are you in testing on humans?
Right now, our timeline has us entering the clinic in about 2.5 years after the close of this round. And that's in indications such as head and neck and breast cancer. Those are easier cancers to get to initially, and then hopefully we'll plan to expand to other indications as well.
Okay, thank you very much. Awesome. So from everything, from the contents of our refrigerator being digitalized these days, it's about time we also digitalize vaccinations. Please welcome Dr. Nadira from ImmunifyMe to the stage.
Hi everyone, I'm Nadira, co-founder of ImmunifyMe. Do you know 3 million people die every year due to vaccine-preventable diseases? 1 in every 5 children remain unimmunized. India has the largest number of unimmunized children in Asia. One of the main reasons for this is we are still using 70 years old paper-based vaccination record keeping, which is outdated, no reminders, no records, not efficient at all. So we need new technologies and new interventions to vaccinate the 5th child who misses their life-saving vaccine. That's why we come in. ImmunifyMe is a cloud-based ecosystem complete with a responsive mobile app and a smart card. We want to make sure your child is receiving all the vaccines they need. For that, we will send you timely reminders about upcoming immunization, and we monitor the physical development of your child as well. So it's a simple process. The hospital will issue you a card and send one-time password to our centralized system. Voila, now you are connected to ImmunifyMe. So when you come for the next vaccination, we simply scan the card and vaccinate your child. So let's say you are a healthcare worker or a hospital. You don't need to write each and every vaccination data and pile up the vaccination records, because you will have real-time vaccination data to take timely interventions even if there's an outbreak situation. So this real-time monitoring will help the governments to find the problem areas and take action. So with our pilots, we have seen 20% improved vaccination coverage, saving of resources and additional revenue for hospitals. So the journey to bring down the immunization gap is done by super talented and enthusiastic team. Lakmal is an AWS certified solution architect, taking care of the technology. Niraj is having more than 10 years experience in healthcare industry, taking care of the business development. Myself, I have a PhD in virology. I take care of the product development. There's a huge market waiting out there. 350,000 children are born globally every day. In Asia itself, it is 250,000 children. Vaccination market is also growing. So by the end of 2018, we want to present in 4 countries, India, Sri Lanka, Nepal, and Chile. And by 18 months of our operation, we are planning to make $1 million combined revenue by selling our products and services to hospitals, vaccination clinics, government and non-governmental organizations. We have right now done 2 successful pilots and working with 6 hospitals. So our journey starts with Startup Chile, and we received the top Global Impact Performer Award in Startup Thailand, and we were among the Gavi Infused Best Innovators in 2018. Last week, we received the Fit for Start grant from Luxembourg. The world wakes up for 7 billion dreams every day, but 10,000 of them will never dream again due to vaccine-preventable diseases. We urge you to come, join with us, save those dreams. Thank you.
So, yeah, the clicker you can put away. So, questions for Dr. Nadira? Anybody? Shara, you always have a question, no?
So, does every patient automatically get the pass and has to sign up for it, or how does it work?
So what we do is we register the hospitals or the healthcare providers with our system, and then the parents will get a card when they register. So it's a QR code based card. So whenever they come for the next vaccine, you have to simply scan the card, and the history of the child is there.
But you can also have the vaccine without the card. Like if somebody decides to opt out of the service,
I'm sorry?
Are you free to choose if you part of the program, or like?
So, of course, right now it's paper-based, and this is 70 years old. Mm-hmm. So, convincing the policymakers to use the system which has been used for 70 years, that's a huge task. So, we are starting with private hospitals. So, because everything is digitizing, and the private hospitals are very welcoming when it comes to digitizing. So, we are starting with private hospitals, but the pilots we ran with parallel to the paper-based system, just to see the outcome, whether anything is missing, so we can get a proper idea. So but the card is very useful, and parents are very happy because they get reminders. What happens most of the time is people don't get proper reminders, and it's a paper-based thing. So sometimes you won't complete the whole vaccination. It's not that you don't have money or you don't want to go. It's just because you simply forget. So the reminding and everything increase the vaccination coverage. Thank you.
Okay.
Thank you.
Thank you very much.
Thank you.
So we have now finally arrived at our 10th and final candidate. There's been a lot of talk in the last hour about issues, problems with tissue sampling. EnvyOx addresses exactly that issue. So can we please welcome to the stage Maria Driesel. Oh, there she is.
Thanks. So when I started this company, I met a lady called Linda, and she was diagnosed with a really aggressive type of breast cancer, and both of her breasts were taken off in a surgery. It's really terrible. But what's worse about her story is that just 48 hours after the surgery, the pathology got informed that her biopsy samples were mixed up in the lab with those of another patient. Linda herself never had cancer. So I'm Maria, CEO and founder of EnvyOx, and we are automating pathology labs to prevent such misdiagnosis and improve lab efficiency. And let me just give you a really brief insight of how the lab looks like today and in 1915. And not a lot has changed when all these 1,000 samples have to be handled completely manually. And one could even say that the only major protest change is that females are allowed to work there now. So this causes a high error rate of 1 to 15% in that area, time-intense processes and helpless for the workers. And while we have come so far in precision medicine, we have stayed so far behind in its basis, the diagnosis. And this costs a lot of money to the lab and to the society. And our vision is the fully connected lab of the future. Therefore, we developed a software to connect the physician with the lab, to be able to track and trace the samples based on a QR code. And based on a special filter, we can, for the first time, automate the sample entry in the lab. And this sounds very boring, like a boring conveyor belt, but what's really special about our machine is the so-called photo box. And we can collect images in a high throughput, and with our AI-based algorithm, gather a lot of data about the size, the shape, and even 3D reconstruct samples that have been broken during transportation. Super important data for the diagnosis, for the research, plus we can send it to further machinery who can all of a sudden run personalized slicing or color staining or whatever happens in the lab. And so we can avoid these errors, increase process efficiency, and the workers are not exposed to that formalin anymore, saving a lot of money. In Germany, we are addressing roughly 550 labs who process 100 million samples with an easy equipment and software as a service model. But cancer is a global problem, and so is the pre-analytics process. And worldwide, we are addressing roughly $15 billion in market potential. Dominic and I founded this company in 2017. Since then, we built a great team of experts, 15 nations, 20 disciplines. And we were able to secure 2 investments. We finished the production of our machine. Just this summer, we closed the first contract with a first university clinic here in Germany and made our first revenue, finished CE certification right now, and now we're looking forward to prepare for the FDA approval so we can scale that out of Europe and into the world. Thank you so much for bringing way more attention on this super important topic, and I'm looking forward to exchange with every one of you after in the booth and looking forward to the questions from the jury. Thank you so much.
Thank you. We have some questions for Maria. No questions. With like so much complexity, they're overwhelmed by the complexity of.
Questions from the.
Anybody else have any questions?
From the audience, maybe?
From the audience?
Oh, yes.
Sorry,
here's
I
a question.
have a question. So how do you integrate the tracking system where the doctors connect to the lab with the standard hospital information system and so on? So is this integrated? Is this a separate application, or how do you do that?
Yeah, so hospitals are really the minority of our customers. Mainly it's really gastroenterologists, urologists, and so on. And they have a certain interface called HL7 where we can just extract the data we need. Everything else he puts right into our system with photos, videos, whatsoever. And the landscape in the lab is really fairly easy. In Germany, we have 3 to 4 main lab softwares where it's the same thing. We provide the HL7 and go right in there.
Any other questions? No. Anywhere? Okay. Thanks.
Thank
you very much. So that brings our startup pitch 2018 to a close. That was like 10 amazing ideas. I think the jury's going to have a tough decision in the next to decide who's going to be the final winner. That will be announced. They're going to get together and decide that. It'll be announced at an award ceremony tonight around 6 o'clock or 6:30 or something like that. Will be an award ceremony where that will be announced. In the meantime, 3 minutes is not a lot of time. There's a lot of amazing ideas. 3 minutes is not a lot of time to learn about that. They're all these startups are available like right to over there on that corner over there. You can go and talk to them the whole afternoon. They'll all be there to discuss further their ideas. Thank you very much.